Hello, I'm Greg Hoppin with Superior HealthPlan, and we're going to share with you some updates to our Star Health Medicaid services for children in the foster care program. So what is Star Health? Star Health is a managed healthcare program that provides Medicaid benefits to children and youth in the Texas Department of Family and Protective Services conservatorship. The benefits to our clients include medical care, behavioral health services, dental and vision services, as well as pharmacy benefits, which we'll review in a separate presentation. Why is there a difference between Star Health and regular Medicaid? Children in the foster care program have greater health care needs because they are at risk for or have been abused or neglected. Up to 80% of children come into the foster care program with at least one medical problem. 1/3 of children come into the foster care program with a chronic medical condition, and up to 80% of children and adolescents enter with significant medical needs. Typically, they need more behavioral health care services, need more assistance in managing their health conditions, and have delays in their development. By being a part of the Star Health program, these children have easier access to health care services statewide. They receive assistance in scheduling their appointments and coordinating services. They have a primary care provider and can establish a medical home. They have emergency care support 24 hours a day and better access to dental, vision, and specialty services. Who is served by the Star Health program? Children and young adults in the foster care program, in kinship care, those who choose to remain in a paid foster care placement until their 22nd birthday, or who have aged out of foster care at age 18 and are eligible for Medicaid services until their 26th birthday, can all be served by the Star Health program. When a child enters the foster care program and is new to the Superior HealthPlan Star Health program, they receive a call from our Member Connection staff. During this call, they assist members with selecting or changing their primary care physician, answer benefit questions about the Star Health program, identify community resources, schedule a Texas Health Steps or TH Steps checkup appointment, or complete a general health screening. TH Steps is the health care for children aged birth through 20 who receive Medicaid. It provides free medical checkups starting at birth and free dental checkups starting at age 6 months. Checkups can help find health problems before they get worse and harder to treat. Since 2008, the state of Texas added new legislation that supports and enhances the original mission and vision. Senate Bill 11 in 2015 created a plan to support the collaborative efforts of the DFPS, CPS, community health providers, RMCO, and agencies licensed to care for children. Details can be found at the website listed here on this page. Medical services for children requiring temporary or permanent care in the foster care system have early screenings and assessments. A child's treatment and care should support their growth and development, education, social learning, and relationship success. This is tied to experiencing both physical and psychological safety. With this goal in mind, the state developed the 3 in 30 initiative. There are toolkits to support child welfare stakeholders. If you need assistance with the toolkit or have any questions, please email the address listed on this page. DFPS and Star Health are in daily communication to respond to your questions and needs. Let's look a bit deeper at the details of 3 in 30. The Texas Child and Adolescent Needs and Strengths Assessment, or CANS assessment, serves as a comprehensive psychosocial assessment, trauma screening, and suicide screening. For youth in child protective services, the Texas CANS 2.0 assessment is a guide for service planning and determining levels of care for youth in the foster care program. This assessment supports decision-making in child welfare, mental health, juvenile justice, schools, and early intervention service provision, including level of care, planning, well-being, and functional status outcomes to facilitate quality improvement initiatives. Versions of the cans are currently used in every state, with statewide applications in 36 states, and there are implementations of the cans around the globe. The 3-day refers to the requirement of a medical exam by a medical practitioner within 3 business days of a child's entrance into CPS custody, meaning the child may be in a kinship placement with a foster family, biological family, or in a residential treatment center. The 30-day refers to the start of a child's periodic visit with the TH-STEPS provider. This is to support assessing growth and development along mental, physical, dental, and health stages. It involves physical examinations and interviews and consultations with caregivers. It also includes initiating and maintaining the child's immunization schedule. When possible, all services provided at a child's medical home, such as a foster care center of excellence, can streamline the services of 3 in 30 initiative. However, some agencies provide the CANS assessment while the child's PCP provides the medical examination within 3 business days and the TH-STEPS exam within 30 days. For exceptions to these requirements, please refer to the DFPS Toolkit mailbox previously provided. We also offer additional training on this subject available at involveyou.com. The goal of Senate Bill 11 was to remove barriers to care and to quickly and effectively address the physical and mental effects of trauma, abuse, and neglect. To schedule these services, clients can reach out to Member Services, Service Coordination, or Service Management at 1-866-912-6283. Also, if clients have lost their ID card, they can call and proof of eligibility can be faxed to the appropriate provider. When the client is ready to book these appointments, remember, the 3 in 30 combines 3 separate yet critical tools for assessing medical, behavioral, and developmental strengths and needs of children and youth entering the DFPS conservatorship. The state requires each component, and together the 3 assessments help chart the path for services of children and youth from the beginning of their time in the program. Under current law, children in the DFPS care must receive assessments noted within 30 days of removal. Starting January 1st, 2019, children and youth will be required to have an initial medical assessment within 3 days of coming into care. By combining the statewide implementation of the newly required medical checkup and CANS assessment, DFPS can have a greater understanding of the needs and strengths of the children and youth in the program. The 3 in 30 is a collaboration between the Texas Department of Family Services, the Texas Health and Humans Commission, and Superior HealthPlan. Listed here are the required assessments and the recommended timelines for each. As we think about 3 in 30 and the importance of informed consent, we must be mindful of the definition of parent, specific to the protection of children. A parent is defined as the mother, a man presumed to be the father, legally determined to be the father, who has been adjudicated to be the father by a court of competent jurisdiction, who has acknowledged his paternity under applicable law, or an adoptive mother or father. The term does not include a parent as to whom the parent-child relationship has been terminated. Why is there a new requirement? The 3-day medical exam, especially as part of the 3 in 30, creates better care for children in conservatorship. National medical experts recommend children and youth in conservatorship see medical professionals early and often. In order to meet the child's medical and physical needs as soon as possible, it's important to routinely and quickly assess children when they come into care. The Texas legislature understood the importance of this and passed Senate Bill 11. Caseworkers can call providers' offices to schedule the exam once they've removed a child from the home. Caseworkers are also required to receive the completed child's exam within 3 business days. By Texas law, children and youth are prohibited from receiving vaccinations at the 3-day exam unless medical consent from the parent is received. However, if there is an emergent need for a tetanus vaccination, this can be administered. And in the event that it is necessary to obtain a vaccination other than a tetanus shot, the medical provider must obtain parental consent to the vaccination directly from the parent. If a newborn is removed at birth, an additional 3-day exam may not be needed if the newborn's birth was facilitated by an appropriate medical provider. If the child was removed from a hospital setting, the caseworker will request a copy of the hospital's medical history for the child, including the physical exam and the discharge summary from the provider. If the child is taken to the ER or an urgent care clinic to seek treatment, the caseworker will ask the medical provider to examine the child from head to toe, and they will request a copy of the treatment or discharge summary as well. If the child was removed from a psychiatric hospital setting, the caseworker will request a copy of the psychiatric hospital's medical history for the child, including the physical exam and, if appropriate, the discharge summary. Emergency visits for the 3-day medical exam are also costly and are overly burdensome on the healthcare provider when there is not a need for emergent or urgent healthcare. The Star Health Member Services phone line is available as a resource to locate a provider that can see the child within 3 business days. If there are absolutely no alternatives, an urgent care clinic is a better alternative than an emergency room. The 3-day medical exam is a medical screening intended as a baseline of a child's or youth's physical health. We know when they are first removed due to abuse or neglect and enter the foster care program, there are social, educational, attachment, mental, and physical issues. The 3 in 30 is an opportunity for the caregiver to obtain necessary medications for a child that may not have been obtained at the time of removal, such as an asthma inhaler or eczema cream. The 3-day medical exam is an additional medical screening beyond what was previously required. It does not replace the TH-STEPS medical checkup or the CANS assessment. This is an additional exam that must be conducted on all children entering the foster care program. The Texas legislature understood the preparation involved and gave DFPS until December 2018 to roll it out statewide. The newly required 3-day medical exam will be rolling out statewide during 4 different intervals throughout 2018. If a child is placed outside of your region within the first 3 business days, you will need to know how the rollout is scheduled will affect the children on your caseload. And the rollout schedule is available in your resource guide. One way to look at the CANS assessment is with the who, the what, and the where. The who is Superior Health Plan at 1-866-912-6283. It's a good idea to encourage clients to have this number readily available so they can call member connections to gain support and access to network providers. A member connections representative will help with their coordination of care. They can help medical consenters schedule assessments. Used for children and families by Superior Health Plan providers, training on the CANS is given by the Parade Foundation. The what is the CANS assessment. Training for the assessment is $12. However, a discount coupon can be requested for groups of 5 or more. Email Lauren Schmidt for more information, and her email is listed on the screen. And the where is available at the websites listed on the screen. All certified providers can be identified in Superior Health Plan's printed Star Health Provider Directory. In an effort to support access to training, please see involveyou.com for our CANS orientation, SHO, and other trainings, such as PMUR and Health Passport. Also, please know many training sessions are available to child welfare stakeholders and TH-STEPS providers at thsteps.com. All children enrolled in Superior Health Plan's Star Health program need a TH-STEPS checkup within 30 days of enrollment. All TH-STEPS screenings must be performed by a TH-STEPS provider in Superior Health Plan's provider network and should include screenings such as measurements for height, weight, and infant head circumference, developmental and nutritional assessments, lead screenings, immunizations, and tuberculosis testing. Remember that annual medical checkups for existing members aged 36 months and older are due annually based on the child's birthday. For children younger than 36 months, checkups are due more often based on the TH-STEPS periodicity schedule. If there are questions about any of Superior Health Plan services, please have the client contact member services hotline at 1-866-912-6283. Listed here are other assistant lines for our clients, such as the Superior Health Plan, DentaQuest, Involve Vision Services, the nurse advice line, medical transportation program, the pharmacy, health passport help desk, and to report abuse or neglect of a child. Our goal is to provide children with the best health care possible. All health records and medical information is kept private. We always ensure that the sharing of medical information meets state and federal confidentiality laws. Discussions with doctors or other health care providers are also kept private. We thank you for attending this session of the 3 for 30 Foster Care Orientation